A recent survey of our cancer patients shows that 88% of patients rate their care here as excellent or good. Here we talk to 3 patients about their experience.
Yeah, I think what I was very impressed with was the professionalism of everybody that I was involved with, you know, the nurses and the doctors and everybody else. I'm very calm. They took as much time as they needed with me. I think for me, the one thing that I found a bit difficult was, I suppose it's the expectations of the time limits between different stages of the treatment. I think, you know, when you're diagnosed with cancer, certainly from my own point of view, you want everything to happen tomorrow or today. And I think particularly for me, when it came to having my radiotherapy after my chemotherapy had finished, I think I was told it would probably happen within 2 to 3 weeks. And then it was actually 6 weeks, so I was getting really quite anxious, you know, wanting that to move forward quicker.
Very useful to have the clinical nurse specialists. They're really helpful, lovely girls, and they're always there to help you, support you, answer questions for you. Where the biggest improvement could be made from my experience is that when you have to go for a scan or any tests, sometimes I've had to wait a month, 6 weeks to get results back, and I have to say that is just hideous because it's very worrying to have to wait all that time without knowing, you know, whether cancer's come back.
My experience of my treatment has been very good actually, right from diagnosis through to surgery and treatment. Everything happened very quickly. It felt a little bit like I was on a roller coaster, but it also felt that there was some urgency behind the treatment, and I felt that I was getting treatment promptly. I think it was 2 weeks from diagnosis to surgery, which put my mind at rest because it meant that I'd been operated on and the cancer had been removed. The only slight thing was I was a little bit uneasy. I used the cold cap, and initially the nurses didn't really seem to understand how to use the cold cap, or some of the nurses were a little bit unsure of how to use the cold cap, and that made me feel a little bit uneasy. I used to have really long hair, and I was desperate to keep hold of as much as I could. And I went to the Living With and Beyond Cancer sessions, and it made me realise that there is life after cancer, and you can live a very good, active, enjoyable life after cancer. And it was just putting everything into perspective, helping me take a step back and realise that yes, I can carry on with my life.
So, as you've heard, cancer is a very individual journey and affects patients in different ways. And these women have given their stories, very brief stories, about how it feels about having cancer and what it's like within Derriford Hospital. The survey that's just been published shows that nearly 9 out of 10 patients found our care excellent or very good. However, there are things we need to do, as the ladies have said, and we continually strive to improve those areas.